Hi everyone. In today's clip, I will talk a little bit about pneumonia. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. So, pneumonia is inflammation and fluid in lungs caused by bacterial, viral, or fungal infection. It makes it difficult to breathe and can cause fever and cough with yellow, green, or bloody mucus. Treatments, of course, depend on the cause and severity of the pneumonia. Pneumonia can affect one or both lungs. Pneumonia in both lungs is called bilateral or double pneumonia. Now, there's also walking pneumonia, which is a non-medical term for a mild form of pneumonia, but it has much milder symptoms like fever and dry cough, while pneumonia has high fever and wet cough. Walking pneumonia also is normally treated with the over-the-counter medication. They can diagnose walking pneumonia just by examination, where pneumonia itself requires more extensive testing. The person can be contagious with walking pneumonia throughout the incubation period, even when they show no symptoms at all. So while all pneumonia is inflammation caused by an infection in lungs, the patient may have different symptoms depending on whether the root cause is virus, bacteria, or fungi, and depends on how they got it. Was it community acquired? Was it hospital acquired? Ventilator-associated pneumonia? Which one was it? So community-acquired pneumonia, or CAP for short, can also be bacterial. And bacterial is usually due to infection with Streptococcus pneumonia bacteria, which is also called pneumococcal disease. And this is the most common cause of CAP. Pneumococcal disease can also cause ear infection, sinus infection, and or meningitis. There are, of course, other types of bacteria that can cause this as well. This tends to be more common type of pneumonia and more severe than viral pneumonia, and it's more likely to require a hospital stay. So bacterial pneumonia is usually treated with antibiotics, and typically it shows up with high fever of 105 degrees Fahrenheit or 40 Celsius, tiredness, rapid breathing, shortness of breath, sweating and chills, chest or abdominal pain, and other symptoms. So viral pneumonia causes flu-like symptoms and is more likely to resolve on its own. Usually there's no need for a specific treatment for viral pneumonia. Viral pneumonia usually shows up with dry cough, headaches, muscle pain, extreme tiredness and weakness, and antibiotics are not effective against viral infections and viral pneumonia, and they're only good for bacterial infections. As a matter of fact, taking antibiotics to treat a viral infection can make the person sicker in the future because of killing the friendly gut bacteria and decreasing your immunity. However, your doctor may prescribe antiviral medications, and these medications are usually very specific to the type of virus. The best natural antivirals, of course, are oil of oregano and cloves. As a matter of fact, and also garlic. As a matter of fact, chewing on a couple of cloves in the morning and night should keep you pretty much safe in a very healthy way. The only thing to note is that cloves and oil of oregano are blood thinners. For example, adding ibuprofen to clove oil before applying it to your skin might increase how much ibuprofen is getting absorbed through the skin, and possibly increasing the side effects as well. Clove and oil of oregano might also slow blood clotting. So taking them along with medications that also slow blood clotting might increase the risk of bruising and bleeding. Those taking blood thinners like warfarin or heparin or other brands should avoid these two natural products. Then there is fungi or molds causing pneumonia that are caused by Cryptococcus and the like, and is quite uncommon cause of pneumonia. But those with compromised immune system are most at risk to getting pneumonia from fungus. Then we have protozoa, which is rare but possible type of pneumonia. Now, hospital-acquired pneumonia or HAP. HAP happens while in hospital or healthcare facility for another illness or procedure. HAP is usually more serious than community-acquired pneumonia because it's often caused by antibiotic-resistant bacteria. So it means HAP can make the person sicker and it can be harder to treat. Next type is healthcare-associated pneumonia or HCAP. HCAP usually happens while in a long-term care facility, such as nursing home or outpatient or extended stay clinics. And just like HAP, it usually is caused by antibiotic-resistant bacteria. Next, we have ventilator-associated pneumonia or VAP, and this is if the person needs to be on respirator or breathing machine to help them breathe in the hospital, usually in the ICU, and they're at risk for ventilator-associated pneumonia or VAP. The same type of bacteria as community-acquired pneumonia, as well as the drug-resistant kinds that cause HAP, also can cause VAP. Next, we have aspiration pneumonia. Aspiration is when solid food, liquids, spit or vomit go down trachea or your windpipe and into the lungs. And if the person can't cough that up, their lungs can get infected. It can be difficult to tell the difference between the symptoms of a cold and flu and pneumonia, and only a healthcare provider can diagnose you. Because pneumonia can be life-threatening, it is very important to seek medical attention for serious symptoms that could be sign of pneumonia. Symptoms such as congestion or chest pain, difficulty breathing, fevers higher than 38 degrees Celsius, coughing up yellow, green, or bloody mucus or spit, loss of appetite, bluish lips, nails, or skin. These are important for you to go and have checked. To diagnose pneumonia, your doctor may ask for a variety of tests like imaging, blood tests, sputum tests, bronchoscopy, and more. From the orthomolecular medicine side and the view, high-dose vitamin C has been proven to help recover from all forms of pneumonia, and there are over 64,000 published articles on this at the U.S. National Library of Medicine. On the alternative medicine side, things like garlic capsules, liquid oxygen supplement, vitamin A, vitamin C, as well as herbs like astragalus, and don't use this if there's fever, of course, echinacea, and don't use echinacea longer than 3 months. And if you have ragweed allergies, for example, you can't take this. And ginger, of course, are some of the recommended herbs and supplements from that side. On the spiritual side and emotional side, this can be related to stored grief, fear, anxiety, feeling like you've had to deal with the world single-handedly, and emotional wounds that have not been allowed to heal. This is basically your body's way of saying or asking us to deal with these emotions and start healing from within. Some physically helpful steps suggested are try to have lots of fresh fruits and vegetables, drink lots of fluids and fresh juices, nothing from the bottles that you buy from grocery store, have green drinks, take pre and probiotics, and if you're on antibiotics, of course, you would need to allow the course to complete before you start these. Stay away from sugar, dairy, fast foods, smoking. A hot water bottle can be placed on the chest to relieve the chest pain. That's all I can think of, and hope this has been of some help. Please ensure to consult your healthcare provider immediately if you suspect any health issues. Like and follow for more. Be the light.